Parkinson's is a neurological disorder that gives rise to a range of movement and non-movement symptoms. It is caused by the loss of nerve cells in the brain, including cells that produce dopamine. There are lots of options available to manage the symptoms and improve quality of life for individuals with Parkinson's. Here is a summary of the treatments that are currently available now. Starting with medication. Levodopa or L-Dopa is the most effective medication for relieving the motor symptoms of Parkinson's. It is converted to dopamine in the brain and helps restore dopamine levels. Levodopa is taken multiple times each day and is available as tablets or capsules called co-caraldopa or cobeneldopa, which have brand names like Sinemet and Madapar. Sometimes levodopa can be given directly under the skin or directly into the stomach. Dopamine agonists. These drugs mimic the effects of dopamine in the brain and include tablets like pramipexole and ropinirole and patches like rotigotine. Once again, they can be taken once or multiple times a day depending on the requirements. Apomorphine is a dopamine agonist that can be given under the skin in some patients. MAOB inhibitors are medications like rasagiline, which inhibit the breakdown of dopamine, extending the effects of drugs like levodopa. And COMT inhibitors, these drugs like entacapone and opicapone, enhance the effects of levodopa by preventing its breakdown. Anticholinergic drugs can sometimes be used to control tremor or overactive muscles, which we call dystonia. And amantadine can help with involuntary movements known as dyskinesia and sometimes with walking. Then we have surgical options. Deep brain stimulation or DBS. This surgical procedure involves implanting electrodes into specific areas of the brain which are connected to a device similar to a pacemaker. DBS can help alleviate motor symptoms in people whose symptoms can't be controlled with medication. Physical and occupational therapy are really important to help individuals with Parkinson's improve their mobility, maintain independence, adapt their living environment, and manage daily activities more effectively. And then speech and language therapists can assess and train people to speak louder and more clearly, and also assess swallowing in people who report problems with that. Lifestyle changes. Maintaining a healthy lifestyle can be very beneficial to managing Parkinson's. Daily exercise, whether it's aerobic and/or core strengthening, a balanced diet and stress management are all really important. And then supportive care may be needed, counselling and support groups to address the emotional and social aspects of living with Parkinson's. In addition to the current treatments, there are lots of treatments currently being researched for the future. Some of the most promising areas of research include disease-modifying drugs. Researchers are investigating drugs and interventions that aim to slow down or stop the progression of Parkinson's by protecting or supporting brain cells. Stem cell therapy. Stem cell research aims to replace damaged or lost dopamine-producing neurons with healthy ones, potentially offering a long-term solution to the problem. And immunotherapy. Immunotherapies that target abnormal protein accumulation in the brain, such as the protein alpha-synuclein, are under investigation as potential treatments for PD. It's important to know that while these potential treatments show promise, they are still in various stages of development, and it may take many years for them to arrive in the clinic. In the meantime, it is important for individuals with Parkinson's to work closely with healthcare professionals to create a personalized treatment plan that meets their specific needs based on currently available options.